Good afternoon, everyone. I am Obaidur Rahman, and I am going to present my free paper on deep learning-based identification of ocular surface squamous neoplasia from ocular surface images. I have no financial disclosures to make. OSSN is the most common conjunctival malignancy in India, and it is a tumor which is visible on the ocular surface and can be imaged very easily. But there are a plethora of ocular surface conditions that might mimic OSSN, especially an early OSSN, and untrained eye may miss early signs of OSSN. So artificial intelligence has already been extensively used in ophthalmology. There are already more than 3,300 articles on PubMed. But when you talk about the use of artificial intelligence in ocular oncology, these articles are only a handful. So the purpose of our study was to apply artificial intelligence algorithms on slit lamp images and explore the utility of AI in differentiating OSSN from non-OSSN. That was a binary classification. And then differentiating OSSN from other surface disorders and normal images. So for this study, slit lamp images were retrieved in a 10-year period and was divided into 3 different data sets. One was HP proven or clinically diagnosed OSSN. The other was surface disorders other than OSSN. And the third group was the normal eyes of the patients without any ocular surface disorder. So any unclear photos and patients with ambiguous diagnosis were already excluded from the study. And photographs with a minimum resolution of 1024 by 1024 pixels were included and then resized to a standard size and divided into 2 broad groups, OSSN and non-OSSN. And then non-OSSN group was again subdivided into other disorders and normal. So data augmentation was performed in this study to rule out any bias of training and for more equitable distribution of data. And then this data was divided into training and testing sets. And then 3 different deep learning algorithms were applied on this data. And then the characteristics of the binary and the ternary classification were studied. So these were the different techniques by which data augmentation was done. So a total of 159 images of OSSN were included. And the combined non-OSSN group had 450 images. So for a more equitable distribution of data, some augmentation was performed and a final data set of 416 OSSN and 415 non-OSSN was achieved. So this is a heat map showing how the AI picked up OSSN lesions in patients. And these were the 3 different models that were used: MobileNet, Exception, and DenseNet. So binary classification divided these groups into OSSN and non-OSSN. And although the performance of the 3 models was somewhat similar, but MobileNet had the highest sensitivity in screening OSSN from the non-OSSN group. For ternary classification, again, the characteristics of the 3 different models were similar, but MobileNet again was the best performing model. So the strengths of our study is that this is the first study in literature to utilize AI for OSSN detection from external photographs. We had a robust sample size. We maintained equitable distribution of images in each group to remove any kind of training bias. There was standardization for resolution and size. And without any data segmentation or data labeling, AI could detect OSSN from non-OSSN group with good performance and had an excellent binary distinction. There are some limitations to the study. One is there was no standardization of gaze, so the photos were in different gazes because of the different locations of the lesions. And ternary classification characteristics were not as good as binary classification. So to conclude, AI is a promising tool for OSSN detection from slit lamp photographs. Without any data segmentation and data labeling, it had a good performance in screening OSSN. And further refining of AI models can be done, and they may be useful for screening and referrals. So this was a preliminary study, and there are future directions to take from this study. The first one, of course, being that we have to further enhance the strength of this study by increasing the sample size, including photos in all gazes for all 3 different groups. And data labeling of structures and the lesions may improve the characteristics and performance of the DL models. The second one is that we plan to further refine this model and then test them on mobile phone photographs. And then finally, the ultimate goal is to bring research to clinics so that clinicians can capture photos, upload them on phone-based or web-based applications for screening of OSSN, monitoring, and referral from peripheral areas and from community. Thank you.
Yeah, can I? Hello.
Yes, sir.
You were, you say there's no standardization of gaze, but what about the photographs itself? Like, how did you
So the
standardize the photographs?
Yeah. So photographs were standardized for upper lid margin, lower lid margin, and the area in between.
But
And
did you use any particular software to crop the image at the correct points and?
it was manually done, sir.
Huh?
It was
It was
manually
manually
done.
done. Okay.
Initially, we had planned to crop it with the software of ImageJ, but we were not getting the desired results. So then we performed manual cropping, and images that were too magnified, not showing the eyelids, they were removed then.
And was the images taken prospectively or retrospectively?
Retrospectively, sir.
So I think if better study would be you take it prospectively,
Yes,
and
Exactly.
so that you can
So use
standardize
this
for both
model
the
to
gaze as
validate
well
it.
as the photograph.
So we're already doing that, sir.
Mm.
But since we wanted a larger sample size, so we had a 10-year data in our slit lamp already. So we took out from the slit lamp bank. But we are already enrolling more patients, sir.
Nice study. I was curious, did you do a predetermination of sample size, or you just took all takers?
Sir, so for AI, as much data as you can feed to the AI system becomes better and better. So
Yeah.
there was no determined
So
sample size.
that is what you had available to
Yes, sir.
study. Okay.
So
The second question was, the rates are about 88%. What were the type of photographs that the machine learning got confused? Where was the errors? What type of lesions did it misdiagnose?
yeah, so sir, we went back to some of the photos that the machine could not understand. So some of those photos were early lesions that were very close to maybe a pterygium, and even some of the normal photographs had been misdiagnosed. So that is something we are again trying to refine.
And
Nick, go ahead. The last, did you calculate the area under the curve for these?
Yes, sir, we did, but I have not included it
Include
here
that in
because of the
data,
paucity of
okay.
time.
Okay.
But we have done that, sir.
And what are the criteria that you use for the computer to learn whether it is to differentiate between pterygium or a recurrent pterygium or and then OSSN? Are you
Sir, no
feeding them-
criteria was used since we did not perform a data labeling.
Hmm.
So first we wanted to see if, without giving any input from the human side, can the DL model detect OSSN? So we are still to do that, and one of the things that might further refine and increase the performance is data labeling.